Welcome, everyone. It is 1:59, and we are about to begin our webinar, but we are going to give it, of course, just a few more minutes to ensure that everyone is able to join us. And while that, we will certainly bring up our slide deck, but we would love to know who's with us today. So please let us know your name, what organization you're with, and your city and state. And what are you looking forward to? Um, you know, for the remainder of 2024, can you believe it's almost the end? Well, it is the end of the year, but it's almost December. So would love to know who is with us today. So if you could in the chat, or if you would in the chat, please lift up your name, your organization, and what city and state you're from. And if you would like to, we would certainly love to hear what you're looking forward to for the remainder of this year. We are almost in December. We want to make sure that we had quite a few registrants. So I'm seeing West Virginia, Kentucky, Georgia. All right. Indiana, Minnesota, Idaho, Maryland, Kansas. Very good, very good. Loving to see everyone. Iowa. So thank you all for joining us today. And we have a mix of community action agencies, as well as health department and health organizations. So we are excited to see you all. And you may even look in the chat and you may see a fellow partner in your area. So thank you again for joining us for the Leading the Way for Community Driven Health Transformation Lessons Learned from the Vaccine Equity Project. This is a webinar that really is really will share with you certainly lessons learned, but this is a project that has been going on for about 3 years. And we really have learned a lot of lessons talking about vaccine equity, health equity, really for all. So again, thank you for joining us. We always start our time together with a few things. Our first thing is our land acknowledgement. And this is where we say every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes in hope of a better life, and some have lived on this land for more generations than can be counted. I am Lily Seals, the Director of Practice Transformation with NCAP. I am located in Charleston, South Carolina, and this meeting is being held on the traditional and ancestral homeland of the Kuso people. And I pay my respect to elders, both past and present, who have stewarded this land throughout the generations. There is a QR code, as well as we've placed in the chat if you are interested in learning about um, the land that you reside or are working on as well. We also do a labor acknowledgement, and we acknowledge that much of what we know of this country today, including its culture, economic growth, and development throughout history and across time, has been made possible by the labor of enslaved Africans and their descendants. We also acknowledge the Chinese immigrants who built railroads that allowed for westward American development, Japanese Americans whose properties and livelihoods were taken from them while incarcerated during World War II, and migrant workers from the Philippines, Mexico, and Central and South America who have worked Pacific Northwest farms and canneries. We recognize the immigrant and American born workers of African, Asian, and Central and South American descent whose labor remains hidden in the shadows but still contributes to the well being of our collective community and who have fostered the conditions for us to be able to access our current quality of life, those who have gathered, prepared food, and provided essential services. The promise of community action. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. The promise of community action is really how we ground all of our work in what we do. So today we have a wonderful agenda for you today. We're going to learn more about the Partnering for Vaccine Equity. So we'll have an overview of that. We'll talk a little bit about, I'll give an overview of the Vaccine Equity Project that we have been on this journey for about 3 years. We have some resources. So as you think about vaccine equity and overall health equity in your communities and partnerships and collaborations, we have resources for you all. We absolutely will have Q&A. So if you have questions throughout, please place them in the chat. Some resources and upcoming events. So who is bringing this information to you today? I have introduced myself as Lily Seals, the Director of Practice Transformation with NCAP. We have Karis Manus, who is our Senior Associate for Learning and Dissemination, and Taylor Daniel, who's our Project Director for Practice Transformation. And running tech in the back is Denise Drake, who's our Administrative Coordinator. I'm getting ready to hand off, and I'm very proud to also introduce that this work that has been done with Community Action has been in great partnership with ASTHO. And we have Geeta Kadnadkarni and Shalini Neer, who we have had the tremendous opportunity and joy to work with in bringing this project certainly to life. So they are going to give an overview of the Partnering for Vaccine Equity. And with that, I'm going to hand off to Geetika.
Thank you, Lily. Good afternoon, everyone. My name is Geetika Nadkarni, and I'm the Director of Chronic Infectious Disease at the Association of State and Territorial Health Officials. Next slide, please. And ASTHO, or ASTHO for short, is the membership organization of the chief health officials in the states, the territories, and the District of Columbia. And those of us who are ASTHO staff, we work with the health officials and their teams to support them in their mission to advance the public's health and well-being. And we work across a wide range of topic areas and health issues. Next slide. This particular project was funded by the CDC under their Partnering for Vaccine Equity program to build the evidence base of effective interventions to improve vaccination coverage and identify and implement strategies to reduce racial and ethnic disparities in adult vaccination coverage. So we started off back in 2021. As you know, there was a lot of distrust, and especially the COVID vaccine back then, as well as many disparities in access and vaccination coverage. So that's where we started. And now I'll turn it over to my colleague Shalini to talk about how we structured this project.
Good afternoon, everyone. My name is Shalini Nair, and I'm the Senior Analyst for Infectious Disease with ASTHO. So to piggyback off of the introduction that Geetika provided, very early on in this project, we at ASTHO identified NCAP and the Community Action Network as a whole as a really beneficial partner to this initiative, primarily because of the impact and the influence that community action agencies have on their communities every day, the trust that they've built up and the relationships that they've maintained over the course of years and generations. And also because the work of public health in many ways complements the work that community action already does every day, addressing the social determinants of health. So things like economic stability, access to healthy food, or access to safe housing. Community action agencies have a diverse network of both traditional and non-traditional partners, and they're adept at finding ways to truly just get things done for the betterment of the community. And because of these factors, we chose to move forward with an initial cohort of 5 community action agencies to be our pilot sites for this work. Next slide, please. These agencies included organizations in Alabama, Arkansas, California, Georgia, and South Carolina. We worked with NCAP to identify these sites based on a variety of factors, but things like vaccination rates in the state as well as the surrounding counties of the CAP agency, levels of actual disease prevalence, levels of social vulnerability based on CDC's index, and then also just organizational capacity at the agency level to take on the work of this project in addition to continuing to provide their everyday services. After onboarding our sites, each of them created a tailored implementation plan that was very specific to the needs of their individualized client bases. It required them to connect with diverse partners and really work holistically to address the health and the vaccination needs of their communities. Next slide, please. Through this model, here we are nearly 3 years later, and our agencies, through their work, have been able to engage with over 50 partners. They have hosted over 300 events, from community fairs to vaccination-specific events to food drives. They've been able to reach over 1.5 million community members, either through direct outreach or engagement through social media and other media outlets. And they've been able to administer over 5,600 vaccinations. And this is inclusive of COVID vaccines, flu, pneumonia, shingles, as well as a handful of childhood vaccinations. Next slide, please. So this project as a whole has been a really great opportunity and a success for all of the partners involved. And we're grateful that this work was actually recently recognized for excellence in program innovation, as well as partnership, which has been a really true cornerstone and a key output of this initiative for us, is these long-lasting and unique partnerships that have been set up. We've also learned a lot over the years about how to best inform and implement this kind of work. And we've utilized several avenues to share on this topic. This includes through blogs, podcasts, presenting at conferences, and, as you'll hear a little more about later, our culminating vaccine equity toolkit. This is all to say that none of this would have been possible without the incredible effort and dedication of our community action partners. So this was a very brief introduction to the project, but with that, I will pass it back to Lily so that you all can take a little deeper dive and hear directly from two of our implementing partners. Thank you.
Thank you, Shalini. So here we're going to talk a bit more about the Vaccine Equity Project. You heard a bit about the background of the Partnering for Vaccine Equity program, when it launched, how ASTHO connected with Community Action, or NCAP, and we did identify 5 community action agencies. I often say, I accepted the mission of, of really deepening their work and talking about vaccine equity and addressing that in their communities. And we can move to the next slide. Those community action sites are Enrichment Services Program, Pickens County Community Action Committee, Community Action Program for Central Arkansas, Palmetto Community Action Partnership, and Community Action Partnership of Kern. So you will see Georgia, Alabama, Arkansas, South Carolina, and California. And just to talk a little bit more about community action. So community action, our mission, to ensure the causes and conditions of poverty are effectively addressed, and to strengthen, promote, represent, and to serve. Certainly, we want to serve the Community Action Network. Community action agencies, there are over 1,000 community action agencies across the nation, and we are represented. We represent every county in the United States, including territories, so Puerto Rico, the Virgin Islands, Guam, etc. So as you heard earlier from Geetika and Shalini, how these sites were selected, really looking at vaccination sites, the vaccination rates in their respective counties. We'll advance. Enrichment Services, you're going to hear a bit more from them, but they were one of our agencies. They cover 11 counties, but for this project, they really focused on 3 counties, Troop Stewart counties in Georgia, and they also cross state lines in Russell County, Alabama. the strategies that they implemented or connected with, and we really looked at how are we working with the whole family. So they engaged families in their Head Start program. They also partnered and looked at those trusted messengers, right, in faith-based organizations. They also worked with large employers, and they really embedded vaccinations and ensuring that that was in community and making sure that they were available at a larger scale. But we will hear more from enrichment services later. For Pickens Community Action in Alabama, they also really looked at working with the local medical and nursing schools to train students on becoming vaccine champions. Again, you will hear a theme of trusted messengers, of which community action often is, and making those connections with. Also, really looking at engaging young adult males through their Head Start fatherhood program and conducting home based vaccinations through outreach workers. That was another, certainly, a strong piece of what we heard in some of the themes. You know, when we're talking about rural communities, because a lot of these communities certainly were rural, transportation may be an issue. There may be other barriers to this. So how could we minimize that? And that is certainly what Pickens County did. We then have CAPCA. So we say that for short, and that is in White County, Arkansas. They also have a Head Start program, so they connected there, but they also used a community survey to identify attitudes and barriers to receiving vaccines. What we in community action, we're required to do a community assessment. That is something that we do on a regular basis to have an understanding of what is going on with our community. So they really utilize that tool to understand what was going on, so that uh, they could formulate a plan and formulate strategies for outreach with partner organizations. They also conducted mobile clinics, and they offered gift cards as incentives. And Cap Kern, our community action partnership of Kern in Kern County, California, they had a unique strategy where community action again is a trusted messenger, but they partnered with another organization as they looked at who their target population was. So they contracted with another organization or other organizations to really make sure that they were serving and meeting the needs of the community that was certainly the target as it related to vaccination. So they did use Medicaid data to target specific zip codes with for the most vaccine inequity. They partnered with local community-owned businesses to reach different sectors, and they engaged community at local events and popular community venues. And they used multifaceted approach to address misinformation through engagement of trusted messengers and different types of media. And we have Palmetto Community Action Partnership. They focused on Berkeley County, South Carolina. Again, you will hear from them later on today. But they work with partners both at the state and local level, the health departments, local university. They used videos, a lot of different media, and also had vaccine ambassadors to conduct outreach, trusted messengers to conduct storytelling, and they had a case manager to connect community members to other services. So just as we know, health is certainly a part as we think about families achieving social and economic mobility. We want to make sure that our families are healthy, and this certainly fit right into that component. So our community action sites, really, we are a beneficial partner, often through our various services that we offer. Um, it really is a connection point. So we were able to work with public health, really due to the existing reach in the community and network of non-traditional partners. So we often work with many in services as we work with families for workforce development and education, in housing. So really looking at those social determinants of health. It was an opportunity for us to, really rise within the moment, um, and working to work with communities to achieve better health outcomes. And how did everyone do this? Well, we used the community action team approach. So each of the community action agencies, they formed a community action team. So it really was a coalition of, after they looked at the rates of vaccinations in their communities, they saw who, which the demographics of who may not have been vaccinated, where there may have been hesitancy, as we talked about those surveys, et cetera, and they really developed a plan. So within this, each of the teams really looked at who were the partners in their community. And we can advance to the next slide. So you will see where they work with, again, state, local health departments, also federally qualified health centers, pharmacy, local emergency medical services, really going back to faith-based, cultural, and other community leaders who were trusted messengers, really making that connection. One thing we talk about often in community action is sometimes we're the best kept secret or the best known secret, because you certainly know us when if the services are needed, but we do serve as trusted messengers because we make those connections across, certainly across sectors. And in the next, here we go. Thank you. So you will see the community action teams. So in that diagram, you'll see three boxes: expanded partnerships and networks, enhanced community capacity, and organized and systemic approach for change. Really looking at expanding partnerships and networks. So the community action teams, they really looked at who who they had existing partnerships with, and asking, as we do this work, who can we also connect with? We know we have to expand our outreach and communications with our target populations. How do we build a team that supports that? And we looked at the organized and systemic approach for change. We know that a lot of public health issues, or barriers, are multifaceted and complex. So how are we ensuring that we're building a team that has those from different sectors, backgrounds, and experiences, so that we can all work towards a particular goal? Then we had enhanced community capacity, because one organization certainly cannot do it all. So when we think about bringing our teams together, how are we building a team so that we can ensure that, as we talk about our messaging, as we talk about bringing vaccinations to the forefront for community events, et cetera, how are we ensuring that we are all connected and we're able to work together to increase our enhanced community capacity? So we are now going to hear from Enrichment Services Program, and we are going to hear from the Palmetto Community Action Partnership, and they are going to share certainly their journey in the their vaccine equity project, and how they utilize community action teams to really increase and enhance vaccine equity in their communities. So with that, I will hand off to Jamie Thomas with Enrichment Services Program.
Right. Thank you, Lily. Welcome, everyone. Good afternoon. I am very excited to be here today on behalf of Enrichment Services Program. So a little bit about our agency. Lily did a great job of kind of giving you an overview, but I'm just going to go in depth a little bit more. The mission at Enrichment Services Program is to empower families to thrive through quality education, services, and partnerships. Like Lily mentioned, we do have an 11-county service area, 10 counties in Southwest Georgia and 1 county in East Alabama. Our service area has an average poverty rate of 19.4%, some of our counties as high as 23%. So the target counties for this project are the ones that are circled. So you'll see Russell County and Alabama on that far left, and then Troup and Stewart counties, one to the north and one to the south of our service area. So we do serve over 1,300 children and families with our early childhood education programs. We have Head Start, Early Head Start, pre-K, and some child care partnerships. An interesting fact about us is that we do serve 3 counties in the top 10 Georgia counties with both aging and declining populations. And 2 of those counties are in the top 10 Georgia counties with the highest poverty rates. Not the best statistics, but it gives you an idea of the population that we are serving. Next slide. So we like to categorize our services into 4 core service areas, education being our early childhood programs. We also offer employment training services, which are short-term scholarships for credentials in fields like certified nursing assistants, commercial driver's license, facilities maintenance, and customer service. We also have our stabilizing services, which would be our energy assistance. So LAHEAP, we also do water assistance, and we have food distributions through a partnership with our local food bank. Our family strengthening services include family assessments, case plans, case management, family-centered coaching, and then financial capability services. Next slide. When we think about vaccine equity and when we were approached to do this project, we really had to think of our why, because we typically don't focus on health equity. The only real programs regarding health were embedded into our early childhood education program with the requirements that are mandated by the Office of Head Start. So when we looked at vaccine equity, we really had to come up with a good mission statement as to why we wanted to participate in this project. So our why was really to ensure that everyone in our service area has equitable access to knowledge, services, and resources. And access was really that key word there. We serve some of the most rural counties in South Georgia. Stewart County being one that was identified by the project was important to us to really look and examine that county and really look at the barriers as to why individuals not only weren't able to get vaccines, but in the long term, we started looking at why they weren't able to get access to other healthcare services. And we did come up with a unique logo for this project, and we branded all of our project materials with this logo. Next slide. So talking about the community action team or the CAT team, starting out with the team formation, because we were the only agency that was working with 3 different, very unique counties, we wanted to take a different approach. So we wanted to have an overarching steering committee that was made up of our key stakeholders. That would be people from our health departments, from our federally qualified health center, community leaders, and of course, subject matter experts. Then as we looked at each of the 3 counties that we were serving, we wanted to make sure that we had a local team that was going to be there. And really, they were kind of the boots on the ground in that community. We wanted to make sure that those people had strong connections to their community, they had good relationships with the public, and that they were trusted among their groups. Again, some of those counties being very rural and very small, it was important to make sure that we weren't viewed as outsiders or somebody that was coming in and trying to tell people what to do or tell them what was best for them. We wanted them really to be involved in the process. Next slide. So after we formed our steering committee, we really looked at the goals of the project and then the goals that were important to us as an organization. So increased vaccination rates was a goal. Again, these counties were identified as having very low vaccination rates in comparison with the surrounding counties. It was also important for us to increase the trust among our customers and our partners. We wanted to make sure that throughout our partnerships, we developed very strong relationships, and trust was a key element in that. And the most important thing that we really realized with this project is we wanted to have positive messaging surrounding COVID-19 and other vaccinations. So when the project first started, there was a ton of misinformation, there was a lot of vaccine hesitancy, and there was just a lot of unknowns, and people were very skeptical about the COVID vaccine. And as we kind of further involved ourselves into that project, we started to introduce other vaccines that were available to those communities that we were serving. Next slide. So our strategy was really focusing on developing the trusted messengers. Again, I can't stress the importance of the fact that these are small communities and they aren't very open to outsiders telling people what to do, essentially. So it was very important to have that message come from somebody that was trusted. Participating in existing events. So we were a limited team, very small team. We were spread very thin when we were covering such a large area. So one of our strategies was, instead of trying to create our own events and market them and try to get participation, we partnered with other community organizations that were already having events in the community. So one example I can give of that is during the month of August, it seemed like every weekend there was some sort of back to school fair or giveaway, something going on with families that were participating, and people were coming out to those events. So we really worked with those organizers of the events, whether that be a school district, a community group. We told them about what we were doing, what we had to offer, and how that would benefit the people that were, targeted to go to their events. So that allowed us to have a little bit lighter of a lift on, trying to organize an event. Basically, we just added value to the event that was already there. And when we look at faith-based outreach, that was a huge component of our success. Really looking at the South and how important and how much of a staple the church is in the community. So we built relationships with different churches and they invited us there. We would go maybe on a Bible study night before a Sunday service. And at that point, were able to get in front of that congregation and just tell them what we were there for, essentially, letting them know that, this is something that we are trying to help your community with, telling them the benefits and really kind of honing in on that messaging, the key messaging, dispelling any myths about vaccines, and really telling them why it was important for them to get vaccinated. After we, came to that event, and it was very informal and no pressure at all. We allowed people to ask questions and really feel comfortable. And we would tell them that, hey, we're going to be at, the school next weekend, and we have vaccines available. If you're interested, come on out and, learn more about it if you're still not sure. But we just wanted to let them know that they weren't just going to see us one time. We were there, giving them that information the first time. And then we were letting them know that, hey, we're going to be in your community and we're going to be partnering with this school or this organization whom they already have a relationship with, and come back and see us again. And we saw that to be very effective. We were able to build that trust. And because the people trusted the church that they were at, and that congregation or that pastor allowed us to be there, that trust kind of transcended to our relationship as well. Next slide.
Right.
Yep. All right.
Thank you so much, Jamie. She's like, she has so much information to give. She was ready to keep
So,
going. Thank you.
yeah, I thought I was gonna keep going, but again, it's been a long, Lily, I guess it's 2 years, but it's kind of going into 3 years, and we just really appreciate the opportunity to be part of this project. It's really allowed us to grow as an organization and kind of expand in some different service areas that we haven't been into before. And we plan to continue to work in this space in the form of just overall health equity. Even though, the vaccine equity project may not be continuing, we still really value this experience.
Thank you so much, Jamie. We do have a couple of questions. One question is, how did you respond to myths or any pushback in these outreach spaces?
Yeah, so there, I would say responding to the myths is we would always fact check. Fact checked was important, making sure that we were getting information either directly from the CDC. We would check with our partners and the team at ASTHO so that they would know, if we heard something that maybe they hadn't even heard of yet, they could really do the research on it and get back to us. If we were on the spot and at an event and there were people that challenged us or had questions, then we would just give them the information. And sometimes it was more important to give them the information than to get them to get a vaccine. Because at the end, we really wanted to make sure that they were able to make the right decision for themselves and their family based on accurate information.
Thank you for that. And then the next question is, how did you secure funding for this effort and recruiting of partners?
So this project was funded through the partnership and ASTHO and CDC. So we did have funding for that, which did allow us to work with our vaccine providers. Some of those vaccines were, provided for free under the various acts with COVID. And then one of the things we realized is sometimes providing an incentive was very helpful. So with some of the funding that we received, we did provide Walmart cards, gift cards, sometimes depending on what the vaccine was. So in the beginning, when with COVID, you had to have I want to say the initial shot and then maybe 2 boosters. We did kind of a tiered approach where it was like $50 gift card for their first shot. And then when they come back, they could get a $25 one for each time. So those incentives were very helpful, especially in those rural communities. Those were able, to provide people with ways to get groceries where they might not have had groceries or just different things. So that was very helpful.
And our next question is, how did you get to speak to the community at the church?
So it was, those parishioners, the members of that church that went there. There were some churches that may have been small. The average attendance, I would say, was between 50 and 100. So we would prepare a couple days before. We would bring, bags with flyers in them, brochures, information about vaccines. We had some branded material, whether that was like pens or in churches in the South, a fan is very common. So we had lots of fans that had that vaccine equity logo on it, and it had our 3 key messaging points. And we really just kind of drilled that over and over again. And after they saw those materials, that's when, we would tell them, hey, we're going to be back in your community this weekend. Come and see us. We will have vaccines, and we'll also have gift cards as an incentive. If you come and we would say, do your part and get vaccinated. And then you'll get, whether it was a $25 gift card or a $50 gift card.
All right, well, thank you, Jamie. I do not see any other questions, so I will see if the team is lifting anything up. I think that's it. So
Well, thank you.
thank you so much, Jamie. Really appreciate that. And now we will hear from Patrice Simmons with Palmetto Community Action Partnership.
Good afternoon, everyone. As Lily just said, my name is Patrice Simmons with Palmetto Community Action Partnership. I'm the Vice President of Customer and Community Services. As you can see on your screen, we chose to brand the Vaccine Equity Project for our county as well. We said to protect Berkeley County. And when you think of vaccines and why you choose to vaccinate, it's for yourself, for your family, and for your community. Next slide. So a little about Palmetto CAP. Our mission is to serve the economically underserved residents of Berkeley, Charleston, and Dorchester counties by promoting economic independence through programs and partnerships. So, as Lily stated earlier, community action partnerships are all about relationships and making connections because we cannot do this work alone. As you can see on your screens, Palmetto CAP covers 3 counties. And so the largest county at the top is Berkeley County. And then next slide. Another fun fact about us is our weatherization department also covers Beaufort and Jasper counties. So we actually serve 5 counties when you're including weatherization. We were established in 1985, but in 2014, we used to be known as Charleston County Human Services Commission. And in 2014, we took on the additional 2 counties of Dorchester and Berkeley counties, and we transitioned to Palmetto Community Action Partnership. Currently, our agency has a little under 40 employees. We receive our funding through a combination of federal grants, local business donations, and private citizen donations. We cover asset building, emergency services, covers energy assistance, water assistance, and rental assistance. Our employment and education department assists with tuition assistance, on the job training, and any certification programs that you need help with. We provide funding for that. We also have an affordable housing program that assists with affordable housing properties that we do monthly renting for. And then we also are building homes where we sell at the affordable housing rate. Our home weatherization department, we like to say that it's not about making it pretty, but we definitely make it energy efficient. And so we have a home weatherization department. Last year in 2023, we were privileged to serve 17,651 individuals and 9,596 families. Next slide. Okay, so when we're talking about the Vaccine Equity Project and we're thinking about our why, as you could see on the previous screen, the healthcare piece has not really been a focal point for our agency, but it's definitely been in many discussions. So Palmetto CAP always prioritized equity, particularly in areas like food and food assistance, food and nutrition, housing, community support. But the Vaccine Equity Project allowed us to broaden our equity work into the healthcare space, an area we had not previously focused on. So through leveraging our existing community relationships, we were able to further assist those vulnerable populations, our seniors, our grandparents, raising children, young children, their grandchildren, and those persons with disabilities and people who face barriers to healthcare. Next slide. So in creating our community action team, we looked at different areas that we wanted to make sure that we covered. We wanted to ensure that we reached individuals in the healthcare space. So we had to do some research. We needed trusted messengers, trusted community partners, influential voices. As I previously stated, we only became the agency that covered Berkeley County in 2014. So what we really realized through this project is while we've been around and we've been doing a great work in the Tri-County area since 1985, much of the community in Berkeley County did not know who we are, and had not heard about us. So we really had to leverage those trusted voices. We were able to utilize our current partners. We were able to utilize relationships within our team at Palmetto CAP, referrals, and then ASTHO was able to also give us some connections for the community action team members. Ultimately, if you go to the next slide, please, we were able to have a total of 13 community action team members that were comprised of our local health department, our state health department, the South Carolina Department of Public Health, formerly known as SCDHEC. We had a social worker. We had members from our state Community Action Association, local nonprofits, a newer small nonprofit, local county government partners, a board member from our agency was on there. We had healthcare sector representatives, local college, and a county EMS worker. Next slide. So when we were figuring out how we were going to do this work, of course, we created goals. Our main goal was access to vaccines and to educate people about vaccines. Much like what Jamie encountered, we had a lot of opposition to vaccinations in Berkeley County. Many of the people there just didn't believe that it was necessary. They felt like the entire vaccine process happened too quickly, that the vaccines were created too quickly. And so we really had to leverage um, our partners to get trusted messaging out, to get accurate messaging out. And so our relationship with the Department of Public Health really came into play. They were able to connect us with trusted, accurate information that we couldn't readily find for. Number one, for the data for Berkeley County, but then also for the information through the CDC. So we utilized a media campaign where we had radio spots. We went in and we did interviews on the radio to talk about the work that we were doing and the availability of vaccines in Berkeley County. We hosted small events, and we did that in partnership with faith communities. And so we also created ambassadors. Let me double back a little bit. So we had our community action team, but we also had ambassadors. And then our ambassadors were really those persons that we utilized to execute the events. And so for the small events, we had two pastors that were ambassadors. And so they were really able to get us into several existing events in Berkeley County, where we found that at the smaller events, you were able to make a greater connection. And so you were able to answer those questions about the vaccine. We had nurses from the Department of Public Health on site who were able to give out trusted information and administer vaccinations. And then at our large events, we were able to really make a connection with the community. We were able to partner with the members of our community action team and their organizations. And so as where Palmetto CAP may have not have been as well known, the partners that we were working alongside were well known. And so our large events were very successful. We offered vaccines and education. We hosted a community day event at a local high school. And so we were able to collaborate with the school district. And we actually were able to execute that event through the collaboration of one of our community action team members. We assisted more than 3,000 people at that event with education. We were able to give out free items that they needed. It was almost time for back to school. We hosted it in July. So we were able to give out clothing, household essentials, personal items. And so that was a really effective and great day. We then had a sports extravaganza, and we were able to do that in partnership with our local government collaboration. And we hosted it at one of their facilities in Moncks Corner, South Carolina. And so again, through that community action team member partnership, we were able to have retired NFL players there in attendance as trusted voices, trusted members, messengers, to be able to get out the message about vaccines and the necessity for them. And we also utilized new partnerships to be able to reach those untouched sections of the county. So we wanted to broaden our impact, and we did that also through those new partnerships. And then one of the main points that we wanted to ensure that we were able to do is to sustain this work, because as I said earlier, we wanted to continue to branch out with health equity, with equity in the healthcare space. So we wanted to build a foundation for future equity in the healthcare space. And this project addressed the immediate needs while laying the groundwork for future initiatives. We're grateful that we found a way to continue to promote this project. We do it through our community outreach events, where we provide energy assistance, and we do that on site at different locations. And then while we have the energy assistance, we also provide vaccines and we provide education. So as we're in August and September, we could not get any vaccines. We couldn't even get flu vaccines because they weren't available yet. We provided education, and we were able to answer questions, and we were able to redirect them to Federal Healthcare Network that we partnered with and the Department of Public Health, where they can get vaccinations. Next slide, please. So just a little bit about the outcomes. The logos that you see are some of the collaborations that we were able to make and the partnerships, existing partnerships that we were able to leverage to be able to execute our goal. We actually, that number is outdated. We had around 50 events since the beginning, able to reach more than 5,000 people at all of these events, and we provided a total of more than 1,100 vaccinations. And so, through our collaboration with Federal Healthcare Network, we were able to provide more than just COVID and flu vaccines. We were able to provide all of the required vaccinations for adults. And through the funding that we received from the CDC, we were able to pay for those vaccinations that were given at FEDER. So the Department of Public Health provided the outside resources for vaccinations. And then FEDER, the partnership with Federal Healthcare Network, provided the inside clinician resources for vaccinations. And we really got a lot of positive feedback from persons who would not otherwise have been able to afford to pay for vaccinations that weren't covered by their healthcare providers, either due to age or any other reason, not having health insurance. So we were able to cover those costs, and we're still covering those costs through Federal Healthcare Network, and we're really excited about that. Next slide. And so some of the lessons that we learned through this project, relationships are so key. Relationships and networking, we hear that all the time, but it's not until you really need to implement something like this, something at this large of a scale, that you really see that having these partnerships and relationships with other organizations that are working alongside you and doing some of the same work, similar work, that can connect you with those key messengers, those trusted voices, they matter. Even the relationships that you have in your houses of worship or your affinity groups, sororities, fraternities, those really opened doors for us to be able to come in and have our outreach events where we were able to provide vaccinations and provide education. So partnerships do provide opportunities. Persistence pays off. We really had to make persistent and consistent phone calls and emails to connect with some of the people that we ended up having great relationships with, great partnerships with, because we're all busy. You know, a lot of people are short staffed. And so it's not that sometimes people don't want to work with you, it's just that they're so inundated and overwhelmed. So persistence pays. You know, sometimes you just have to pop up and say, hey, you know, who you are, the organization you're with, the work that you're doing, and then, you know, leave a business card and wait for them to call back and make that connection. That works. We found that large events build awareness and build trust. And we also found that smaller events yield more vaccinations because you're able to make a greater connection. You're able to answer those questions. You have the nurses that are on site. It's not as overwhelming. And then we also found that at the smaller events, you'd have grandmas calling their grandchildren, hey, they have free vaccinations out here. We utilized incentives as well. We had gift cards. We had Visa gift cards and Walmart gift cards. We did vanilla Visa gift cards and Walmart gift cards. And so those worked because when people came to the events and they saw that we had gift cards, they were making phone calls. And so we had a few people, quite a few actually, first time vaccinators that came because of the gift cards. And we were able to address their concerns. And they felt that getting their vaccination from the Department of Public Health, who's a trusted resource, they felt comfortable making that initial. Getting that initial vaccine. And also within the events, location matters. So at the larger event, our first large event, we had the vaccines across the field. And so we found that people did not want to walk that far to get the vaccinations. So at the subsequent large event, we had the vaccines literally as they were coming in, and we definitely had better results. We had more vaccines, actually twice the amount of vaccines we had at the first event. And we were able to make greater connections because the line was so long so that people were able to get information, get brochures. We had a Jumbotron out there where we were able to also leverage the media resources that we had created. So our ambassadors had given testimonials about why the vaccines matter to them and why they chose to vaccinate. We had those. We had partnered with a local and trusted physician, and she had recorded a commercial. And so we were able to utilize that, and people really know her and trust her voice. and her office. And so it was just a great way to get that message out. And so we were just privileged to be able to be a part of this project and to really see how connections and relationships and how the community action team really helped execute and helped us to achieve the goals of getting awareness out and getting more vaccinations out and readily available. Thank you.
Thank you, Patrice. That was excellent. We do have a question. And I think it's something that we could probably answer, but would love to certainly hear from your perspective. The question is, did the funding for the project cover the cost of vaccines? We found it challenging to get vaccines coverage for certain vaccines in general, as many of our community members did not have insurance. And there were issues with billing for vaccine coverage like RSV and COVID-19. A lot of community partners needed reimbursements or insurances to cover outreach events for vaccine clinics.
So for Palmetto CAP, we had a relationship with Federal Healthcare Network because one of our former employees was on their board. And so we actually thought it would be more expensive than it was. I don't think they gave us a discount. However, they do get grant funding themselves because they're a free healthcare clinic and they're free. However, if you have insurance, so we were able to cover the cost of those vaccines. It wasn't very costly at all. I don't know. We never found out whether or not that was a discounted pricing, but we're still paying for those up through December.
Thank you, Patrice. And FEDER is a federally qualified health center. Is that correct?
Yes. So they do get federal funding, but they're community based.
They are community based. All right. So that is certainly an option, thinking about federally qualified health centers in your community. Thank you so much, Patrice. So appreciate that. I think that's the only question that we have here. So I know we're getting short on time, but if you have any other questions, please place them in the chat and we will move through. We do have our vaccine equity resources. So we have talked about this journey with our 5 teams, with this great partnership, really, as we look at advancing equity, certainly with public health initiatives. There is the Championing Change Toolkit. So this is a very large toolkit. You'll see on this slide where there's a QR code. So you're able to check, you're able to place that there. I think we may also have a link in the chat for, yes, we will, if you have registered for this, I'm sorry, Taylor beat me to it, that we will absolutely have the recording for you that's available. But we do have the link for this, so you can really get from the beginning to the end of all of this whole journey of the projects, the 5 teams, how they work really integrally with the state and local health departments for vaccine equity. Our next tool and resource that we want to share with you all really focuses on it's Championing Health Equity, a practical guide for communities in action. So this is really looking from a community-based organization perspective. So thinking about how the teams formed their community action teams, this really walks you through that. And this is, again, where you're able to access the toolkit and really walk through those different components of building your community action team. Our next resource we have lifted up. We do have a vaccine equity webpage. So again, as it has all of those 2 tools that you saw previously, but it does have even more information. So if you'd like to actually click on and learn more about the community action agencies, there are links to them. There are articles, there are podcasts. So however you may learn or however you may want to engage in learning more about vaccine equity in this project, you have the opportunity to do that. And what we're really excited about, I'm getting ready to hand off to my colleague, Taylor Daniel, is we have an e-course, Advancing Health Equity Lessons from the Vaccine Equity Project. This is another way to engage as you really think about vaccine equity and health equity, certainly in general. How are you building and working towards a shared goal in your community? This is a tool and resource for that. So with that, I am going to hand off to my colleague Taylor, who will walk us through that. I think we'll get ready to take the slides down. So,
Hello, Lily, and thanks for sharing. It's great to be here. Hopefully you can hear me all right. I am going to share my screen and I'm going to show you how to access this new great learning series that we have developed. So Community Action Academy is the partnerships online learning resource tool where we have a series of courses that you can take. They are free of charge. And so with that, this is our homepage. A lot of you have been in Community Action Academy, so this is very straightforward. But what we have done is as Lily said, we do have a learning series, which is going to be a series of courses. So I'm going to show you how to get to that. You simply go to the menu here, go to course catalog. And what we've done is, though they're for individual courses that is within this learning plan, we've put them all together. Therefore, that when you register for the learning plan, you register for all of the courses specifically. So you'll simply click on it. All right. And as you can see, this is free. You can enroll, and here you'll see all the courses that we have. We have for introduction, we have a deep dive into the program, to the project. We have building effective community action teams, leveraging community voices, and learning and growing through evaluation. So all you have to do is click enroll, and you can start learning. You start with the first course. And as you continue to go through, each courses are a series of videos with also a few little questions, just so you can test your knowledge of the information that you've gained throughout the course. And we also have this course repository. So Lily mentioned the Championing Change Toolkit. We already have it linked for you. The Practical Guide for Community Action in Action, we have that for you. And we also have a direct link to our vaccine equity webpage. And so once you have gone through all the courses, you're eligible, you'll get a certificate of completion, and then you'll learn the lessons that were gleaned from the vaccine equity project. And so with that, I'll pass it off to my colleague Karis. And if you have any questions or issues accessing Community Action Academy, you can email me. My contact information will be at the end of this, and we'll also provide that in our follow-up email. Thank you.
Thank you, Taylor. Yeah, so we just wanted to share with you some additional resources that we have available through the National Community Action Partnership. So we have coming up at the end of January, our Management and Leadership Training Conference will be January 29th through the 31st, with a pre-conference on January 28th. And we'll be in New Orleans, Louisiana. So we hope you can join us there, and we'll share the information with you for how to register and learn more about that in the chat as well. We also, as Taylor mentioned, we have the Community Action Academy. So this is where you can access the health equity course as well as any of the other courses that we have available there. So we'll share the information with you for how to get logged on and access the Community Action Academy. And then we also have an opportunity for you to help shape the NCAP public policy priorities. So we had in October and November listening sessions that were held. We have an anonymous survey that is currently ongoing. There are 2 more days left to participate in that survey. And then we will have a network webinar where we'll share the process update and opportunity to provide feedback on those policy priorities that is coming up December 10th. So we hope that you can take advantage of that by completing the survey and participating in that webinar that's coming up in the beginning of December. We also have Fresh Finds. This is a page that's available on our website where we share the latest anti-poverty resources. So any resources, webinars, funding opportunities from other organizations that are engaging in anti-poverty efforts. And we keep this list updated periodically. We also have a newsletter that's going to be coming soon as well, so you can receive these Fresh Finds directly into your inbox So we have the information there for you to access that and learn more about that. And then we have our contact information. So if you have any other questions or want to reach out to our team here at NCAP, we have our email address available for you here as well. But thank you all for joining us today, and thank you to all of our presenters at ASTHO, Enrichment Services, and Palmetto Community Action Partnership. Thank you all so much for joining us today.